Good afternoon, everybody. Thank you for coming along to my session this afternoon on patient and public involvement and engagement. My name is Alex Jones and I'm one of the Research Delivery Managers within Clinical Research Network Wessex. And I have two roles within the network. The first one is looking after patient and public involvement and engagement, which is why I'm coming to talk to you today. And the second part of my role is looking after research that takes place in community settings with a particular focus on public health and social care work. So when we think about PPIE, it's an acronym that's used in various different industries, and I thought it would be helpful, first of all, just to frame today's talk with some definitions about what we mean when we think about PPIE and the types of activities that can cover. So I've taken these definitions from the UK Standard for Public Involvement. This can be found if you were to type into Google and it will bring up the standards for you. And these were put together to try and provide consistency in how we approach PPIE. So when we're thinking about the people that are involved in that process, it does cover patients, which perhaps is the group that we're more familiar with in a hospital setting. It also covers service users, survivors, so people who have undergone treatment or trauma, the carers and family members of people going through the healthcare and social services systems. And when we're thinking about these different groups, we tend to refer to them just as the public, because as we know from the vaccine work, this can also include healthy volunteers. The language that we use is about research being carried out with or by members of the public, rather than to, about, or for them. So the idea is that these individuals are really embedded in the process with us as researchers. So the I is for involvement, and this is where members of the public are actively involved in research projects and within research organisations, just like Hampshire Hospitals. And there are some examples here of the positions that people might hold. It may be that they actually sit as part of the research project team and go down on your grant application, or actually as the grant holders themselves. They could be involved in identifying research priorities, and this is particularly helpful when we're looking at seldom heard voices or underserved communities, and I'll talk a little bit about some examples of underserved communities later. So it might be that you're actually asking people to help you approach particular groups and to identify what they feel are particular areas to research. We often hear, for example, that mental health patients and service users feel like they're over-surveyed. So it can be helpful to have people with experience of these conditions sitting as part of our panel and actually thinking about what the particular questions are or particular research agendas that they would like to see prioritised. It may also be that you have members of the public sitting on your advisory or steering group so that you're accountable to them as you develop your project, and once you're up and running you can be reporting back the findings and discussing ways of improving recruitment into the study. And perhaps one of the more common ways that we see people involved is reviewing the information leaflets or research materials. So asking them to check that the language is understandable, asking them how long it might take them, for example, to complete an online questionnaire or case report form, and getting their general feedback about the suitability of the material that you're producing. It may also be that you actually ask members of the public to join you as part of the research delivery team, and this could be that they help to conduct interviews or are present when you run focus groups, or that they're the ones actually carrying out the research themselves. The E in PPIE stands for engagement. So this is where information and knowledge about research is provided to the public and results are disseminated. And there are various ways that we see this happening normally when we're able to do face-to-face events. So it could be that you do science festivals where you have discussions around research. There are some fantastic events run by a team called Pint of Science, which funnily enough run in pubs where they present different research projects, and it's meant to be much more accessible for people in a much more relaxed environment. You can also do open days within research centres. So we have seen, for example, a dermatology centre that runs research open up to members of the public for them to come in and take part in mock trials to see what the process is like. So you'd consent them and randomise them. And in the example I'm thinking of, they randomise them to different colours of Smarties and then ask them to fill out a very brief questionnaire. It could also be as simple as raising awareness through things like social media or TV adverts. And I'll mention at the end of today's talk some of the national campaigns that we have that you might want to use to help spread the message about research. And we're always looking for posts and good news stories that we can either share through our Wessex newsletter or on social media. So if you have examples or members of the public who would like to share their experience, we'd always be really keen to hear from them. And lastly, the other way that we can engage members of the public is about disseminating research findings. And I suppose this is often a tricky one for people because we can't present findings often until a project has gone through to publication, which in some cases can be years after the project itself has taken place. But there are some great ways of telling people about the research project. With the vaccine hubs, we've had feedback that people would like to know a little bit more about where they fit in the overall process of a particular trial. So whilst they appreciate they might not know the outcome itself, they're quite interested to know how many other people have taken part, how far along into the study are they, and if there are any other studies that might be taking place in the future. So it's not always about knowing the exact results of the trial that you're in. So there are lots of ways that you can think about keeping people up to date, whether it's through online webinars or through newsletters that are sent out to people, or even coming up with posters that can be displayed in GP waiting rooms that tell people about recent research projects. And this is a little diagram that I've taken from the NIHR Include website that just highlights some of the areas and ways that you might like to involve the public. So it might be that you involve them in checkpoints for decision making. You might ask them to have a more collaborative role, so coming in to talk about the design. And this can be throughout the study life cycle. So it's really trying to involve people right from the beginning when we're generating research ideas, right the way through the study delivery and adapting the study design if necessary, and then finally ending up with how we talk about the results to members of the public and the people that have taken part. So there's a role for PPIE throughout the life cycle of a research project. And I've just popped a link in here to a really useful guide. It's a little bit old now, actually, but I think still really relevant, which is talking through for researchers some ways that you might like to think about how you disseminate the results, thinking about the language and different ways that you can present findings. And this has been put together by a national team in collaboration with NIHR. To think about how we present things, particularly when it's more complex information and perhaps statistical findings. So if you're interested in thinking about dissemination of a research project you've been involved with, I'd recommend that you go and check out the Sense About Science website. And of course, we can't talk about research without mentioning funding. So actually there are national guidelines for reimbursement for people taking part to support research. So this isn't about how we reimburse people for their time participating in the trial. This is actually about making sure that people that give up their time as members of the public to join our research team and be that PPIE representative are reimbursed. And there's some examples here of the type of tasks and how much you would expect to reimburse them. And this is largely based on how complex the task is and how much preparation might be involved. And we ourselves follow these guidelines in the CRN. We recently appointed 2 public contributors to join our executive group. So we reimburse them for the time it would take to read any preparation material, the time it takes to actually attend the meeting, which might be virtual at the moment, but if it was face-to-face, we'd also pay travel costs and parking costs, and the time it might take after that to go through anything that was raised in the meeting and provide comment or feedback. I say these are national guidelines, so this is what we're aiming towards, and it's often worth thinking about that, particularly if you were to go to the Research Design Service when you're first thinking about PPIE involvement, to make sure that you've allowed for this when you're doing your grant application. And one of the reasons that we make sure that we reimburse people is that it helps us to have a more representative member of the public joining study teams. So we often find it's a lot easier for people who have a higher income to take time out of work to take part in research, or people who might have been retired. It's easier for them to join research groups. And it's much the same when we're thinking about PPIE, as we want to make sure that we're really representing different groups and that it's accessible for people to take up those roles. And so reimbursing them is just part of how we do that. So thinking a little bit more about accessibility, this is really thinking about the content that we create and how we make sure that people can actually use their online software tools, so for example screen readers, to be able to access content about research projects, whether this is specifically to your research trial or if it's more general engagement messaging about research. So it's something we've had to consider a lot recently when we're putting material out into the public to tell them about the vaccine hubs that we're opening in the Wessex area. And there is actually national guidance now and legislation for any public sector website. So any NHS, local government website and our own NIHR content all needs to fall under this guidance. And it's thinking about some things that we might not necessarily consider. So often we use PDFs when we're putting out material to the public because it means it can't be edited, but it can make it really difficult for people to read that if they're using assistive software. It's also thinking about making sure that there are subtitles or captions for images and videos that we use. And these are all ways that we can help make our material more accessible. And I say there is some guidance online. There are also some modules on NIHR Learn. Some of you might have accounts for this already. It's the system that you would access to do good clinical practice training. But you can do a very brief training module on accessibility, and I've popped the links in here to some other useful blogs and websites. There are some sites that you can actually run your text through to see how it would appear, and it will almost tell you how accessible it is. So it's worth checking that out, particularly if you are thinking about creating websites to be the first place that you direct people to when they're taking part in your trial. I touched on underserved groups earlier on. So the Include project is, again, a national collaboration from all parts of the UK, thinking about how we make research more accessible and more inclusive. So the term underserved has been used, you might have heard previously of things like underrepresented, but it was felt that this didn't really fit fairly with what we're trying to talk about here. Underserved groups doesn't necessarily mean one particular characteristic, but I have got some examples on the next slide of some underserved groups that have been identified from the literature reviews that the Include project did. So they came up with a number of underserved groups. It may be that it's a younger population because either they're in school or college, or they don't necessarily have easily available transport to take part in research. It could be the older population who again might have mobility issues. It could be ethnic minorities, socio-economically disadvantaged groups, which is where it comes back to being really important that we reimburse people if they're taking on roles within our study team and providing that PPI function. Pregnant women, people with learning disabilities and people with multiple health conditions may also identify as an underserved group. And these were things that came out of the literature review. There was then a further group who actually met and identified some other underserved groups. And again, this is by no means an exhaustive list. So people who don't have English as a first language. So for us in the network, we've recently engaged the services of a local translation company to create some of our posters which advertise the opening of a new research hub, so that they're hopefully reaching the wider community that we'd like to serve. People who don't attend regular medical appointments, and there could be a number of factors for this. It could be because they're in full-time employment, so it's not as easy for them to come into the hospital or a GP practice. It might be that they're not registered with a GP, they don't have a kind of permanent residence. People who live in remote areas may also feel underserved, again, because it might be more difficult for them to access appointments if they're running in more town-based or less community accessible venues, and that's where we think about, can we take research out to people where they're actually living or working. The severely ill and people in full-time employment may also feel that they're underserved in terms of having the opportunity to participate or help shape research. So what have we been doing to try and address some of these things? I've mentioned a couple of times now about the work around the vaccine hubs. We know that there was initially quite a small demographic in terms of the people that were taking up opportunities for vaccine research. So we really had to think about how do we make our messaging more suitable for the communities that we're trying to reach. So we have had some feedback from members of the public in designing some posters and materials to advertise where the hubs are. We've also been promoting the Be Part of Research website, and I've got a link to that coming up shortly. This is the national campaign that the NIHR run. So Be Part of Research is the kind of message that we've been putting out into the public throughout the pandemic, but it's also the website that people can access to find out more generally about what research is. And there are lots of different videos, particularly at the moment around the development of vaccines and COVID-based research projects. And again, these have been translated into different languages and have tried to be more representative and show a more diverse group of people sharing their stories. Ours FM, I've got a slide about that in a moment, but this was a local initiative that we did with an Asian radio station to tell them about research projects that were coming up. We've also done Ask the Expert events online during the pandemic. So along with our colleagues in our neighbouring CRN networks, we gathered some expert panel members, so some research nurses, some of the chief investigators for the vaccine studies, and we asked members of the public to submit questions either before or during the session, and we had some presentations from the teams. It's a really successful event, and it's something that we'd like to replicate and think about how can we sort of continue on the interest with research that COVID has generated, and are there other ways that we can reach large audiences by delivering things online. And then of course things like this, so any event that's helping support International Clinical Trials Day raises the profile of research and hopefully means that more people are willing to take part when they are approached about a potential project. So the Ours FM project that I mentioned was part of our diversity and inclusion work. So we had 3 sessions that formed part of the radio station's community hours, and we had a panel of experts. We had Saul Faust, who's our vaccine lead, Anoop Chauhan from Portsmouth Hospitals, and Ayman Al-Zatani from Southampton. And they joined the radio host in answering questions from the local Asian community. The first session looked at what is COVID-19, so it gave an explanation from each of the panel members. The second one moved into how the vaccines had been developed. So it was thinking about answering questions around how had products been licensed so quickly in public opinion. And the final session gave an overview of the different research projects that we had available at that time and how members of the public could get involved and find out more. So this is just one example of how we've tried different ways to spread the message about research and try and reach a different community. So some of the campaigns and messages that you might want to refer to when you're engaging members of the public are the Be Part of Research website, which you can link through to here. And as I've mentioned, there are loads of different materials and resources available there that you can share either through newsletters or on social media. You may also wish to engage or initiate a Research Champions programme within the department. So Research Champions are members of the public who are really passionate about research. Some of them might have taken part in projects themselves. Some of them won't have been a research participant, but have a real strong interest in a particular disease or condition, and therefore are really keen to kind of help promote research. And they do volunteer their time. So normally they would go through the Trust Volunteers programme and work alongside the R&D teams and research nurses and clinicians to help promote messages about research. You may have also heard research champions previously referred to as research ambassadors or patient research ambassadors, PRAs, and we have a couple of groups that run across the region. And they can do various activities. It might be that they just speak to their friends and family and promote the message about research. And I know some people have done that via online Zoom calls during the pandemic. It might be that they go along to a local community group. So it could be that they go along to their local GP practice group and talk to them about research. It could also be that they help promote different campaigns as well as be part of research. We've also got a Join Dementia Research website. This is again a national initiative where people can sign up, whether you're a healthy volunteer or a dementia patient or carer of a dementia patient, and you'll be matched to potential research opportunities as and when they become available. So I have signed up as a healthy volunteer, and I've been notified when there are possible trials that are running in the area. Sometimes that's as simple as taking part in a survey. It doesn't always involve going into the hospital or research site itself. And we often see research champions really playing a key role in International Clinical Trials Day and other health awareness days. So they'll often be the people that help to man stands in foyers or go and set up in a local shopping area and promote messaging about research and other events. And more recently, because there are research champions working across the country, the Coordinating Centre within the NIHR have created an online space. I appreciate not everyone who's a research champion will have access or will want to access things online, but the idea is that this gives them a forum to have different discussions and meet with people who are really passionate about research from across the country. And there's a process for signing up with that I can support if you know any patients that might be interested in joining that community. If you've got people who are interested in finding out a little bit more about research, or you'd like a good place to send people as a kind of an opener into what research is all about, you might find that the massive open online courses or MOOCs are a really beneficial resource as well. So these are free for people to access, and they have loads of different course materials available. It's free, and this has been developed with the CRN and Leeds University, and they normally run throughout the year. There are some newer courses that again focusing on the pandemic and COVID research, but the Improving Healthcare Through Clinical Research just sort of introduces the concept of research and how things are tested and trialled. So it's a good place to start if you've got members of the public that would like to know a little bit more generally about the research process. I just wanted to finish because we've been talking lots about members of the public and research participants with some feedback from them. So every year the CRN run a participant feedback survey, and this is designed for us to identify and share best practice or identify ways that we could improve delivery of research across our partner organisations. This year we ran our survey purely through a digital format. So we asked the people working in the vaccine hubs, because this is where most of our staff resourcing was focused for majority of the year. We asked them to hand out a business card which had a link or a QR code that people could scan with their smartphone while they were on site. Then took them to an online survey where they could give feedback about their experience. So these are some of the comments. So that is all in terms of my presentation. I think we have time for questions or further discussions about PPIE, and I can go back through any of the slides, and I'll share these with the event organisers so that you've got the links to the different websites. As I've said, if any of the research champions or members of the public would like to become research champions, I'd be really happy to speak with you and with them about perhaps taking up that role and what it might involve. And again, if there are any examples of PPIE that you'd like to share, we'd always be really grateful, and we'd love to hear about it so that we can perhaps write that up and promote the good work that's happening. Thanks very much.